The Saint Lucian government has secured US $75 million for the St. Jude Reconstruction Project from the Saudi Fund for Development, according to Prime Minister Pierre. The funding will go towards construction of the dialysis and physiotherapy buildings, the new administrative building and the kitchen and power lodging building and the West Wing. According to the Prime Minister, work would start when the loan tenders have been reviewed and forwarded to the Saudi Development Fund for approval.
The government negotiated a novel loan in the Saudi Development Fund, which for the first time included a climate resilience clause. The loan of US $75 million requires competitive tender for supervision and construction of the remaining buildings. The tenders have been evaluated and sent to the Saudi Development Fund for no objection. Upon receipt of a no objection response, construction will commence.
In the interim, Honorable Pierre notes there are ongoing conversations with contractors and end users of the facility.
In the meantime, discussions between the St. Jude Hospital Steering Committee are ongoing with the contractor and end users of the facility. Mr. Speaker, it's expected that work on the George Odlum Stadium will commence after completing 80% of the construction of St. Jude Hospital, according to the loan agreement.
The government of Saint Lucia has approved a proposal to construct a facility to house the new Soufriere Hospital with the bolt agreement submitted for legal review. The site will undergo topographical surveys, geotechnical analysis, and cadastral surveys. The facility will provide primary healthcare services, maternal services, public health services, day surgery, and hyperbaric chambers. This facility will cost US $31.6 million and include $1 million for medical equipment replacement.
A proposal to construct a facility to house the new Soufriere Hospital has been approved by the government of St. Lucia. Consultations between the Department of Economic Development and the Ministry of Health have been completed. The bolt agreement, along with the amortization schedule, the artist impression of the facility, and the other relevant documentation has been submitted to the Attorney General for legal review. The bolt will be for a period of 17 years, with a 2-year grace period and a repayment period of 15 years. The cost of the facility is US $31.6 million. US $1 million has been included in the bolt to allow for the replacement of all medical equipment over a 7-year cycle.
Also under the Health Infrastructure Plan, the former Victoria Hospital plant will house the Castries Urban Poly Clinic, and construction on the Cuban Eye Clinic Centre and Larishes Wellness Centre will commence. The government is addressing high costs of third-party health services by incentivizing local health providers to purchase medical equipment. $1 million has been allocated for further study of rationalizing health service provision abroad. The program includes maternal and child care, 80+ health coverage, cervical and prostate screening, chronic kidney disease screening, and snake bite management. All citizens will have a health card for accessing healthcare services. For Choice News Now, I am Chelsea Austinay.